morning, everyone. So, I'm here to present a retrospective comparative study of the outcomes of the iris saving procedures in the corneal tear management. So, iris abscission in the management of iris prolapse is considered as a necessary and essential procedure in all cases. However, it leads to irregular pupils, loss of pupillary reflex, photophobia, and aberrations, which further reduce the already compromised vision and leads to reduce the quality of vision as well. So, can we safely avoid the iris abscission and save the iris? So we did a retrospective analysis. We included all penetrating injury cases between November 18 and March 21. All zone 1 injuries with plus minus zone 2 extension were included. Iris prolapse should be at the presentation was done in inclusion criteria. We excluded all cases of follow-up less than 3 months, cases of IOFB, zone 3 involvement and primarily zone 2 injuries. Next. So we divided these cases into two groups, group A with iris abscission and group B with the iris saving procedure without iris abscission. We records analyzed for demographic data, mode of injury, time interval at the presentation, presence of the lens injury, post-op events and procedures, and final best corrected visual acuity. So this is one illustration of iris saving surgery where we remove the membrane over the iris, which we excise either or we peel it off. We'll reposit the iris and we suture the wound. Next. So total 27 cases were there in this period. So out of which 19 cases had iris prolapse, they were included in the study. Group A had 11 cases with iris abscission and group B had 8 cases. This is demographic distribution. The significance concentration was in 11 to 30-year-old males. So trauma since hour and injury zone distribution was not significant. The rate of traumatic cataract surgery was also not significant in the two groups, however, two patients in group B underwent procedure for synechiae release, which none of the patients in group A required. The incidence of post-operative infection was 0 in either groups, so no cases of infection was found. The final visual acuity was not statistically significant amongst the two groups. So here we can see that post-operative final outcome of good round pupil in these cases, which is a functioning pupil and can lead to a good quality of vision even with these tears. So in between the two groups, the visual outcomes showed no significant difference. There was no difference in infection rate, so no post-operative infection was seen. No significant difference was seen in the traumatic cataract formation. However, group B had patients requiring intervention for synechiae release. Iris sparing surgery so the conclusion is the iris sparing surgery in the repair of corneal tear gives comparable outcomes as compared to the iris abscission and is non-inferior. Iris sparing surgery is safe and effective in selected cases. In our opinion, the possible requirement of synechiae release surgery is offset by the benefit of pupil sparing. As sample size is small, this needs verification by a larger sample or prospective studies. Thank you.
So, Dr. Mandar, nice presentation, but I have got some clarification in this presentation.
Sure.
So, most of the cases you have shown in the iris prolapse.
Yes.
So, this iris prolapse, what are the most common cause in all this injury, mode of injury in all these injuries causing iris prolapse? Mode of injury.
The mode of injury was at the sharp objects.
Yeah.
Basically.
So, why I ask you this question is that.
Not the globe rupture. It's a sharp.
Yeah. Why I ask? Because all of the presentation, whatever features you have shown, right, all appears to be iris cut or iris prolapse or corneal injury, right, without any corneal wound infiltrate.
Yes. Yes. Right.
So that may alter your outcome of this surgery.
Yes. As I said, it's a selected cases you can do this.
Okay. And another thing is that even if it is a retrospective study, it appears to be very specific for this type of cases. It is not like you didn't intend to take other cases. You just selected these cases and.
Yes, definitely. That's what I want to convey, that we can do it in the selected cases.
Yeah.
Not in all cases, definitely.
Okay. And another thing I wanted to ask: what is the days of presentation after injury? All these cases. How many days after an average?
Within 1 or 48 hours.
48 hours. So that's the catch. So, and why I ask this question is that they decision to take iris abscission or reposition depends on the duration of presentation.
Exactly, yeah.
So,
And
if you have
presentation.
taken clean injuries, then why do you think that iris sparing is needed or iris abscission is needed? If it is less than 24 is 25 cases or whatever number of n number of cases you have taken, all maximum 90% are less than 10 hours or less than 24 hours. Then why do you need to at least
Because I'm
excise the
presenting
tissue?
it because most of the still I see the videos and presentations depicting iris abscission in early cases as well.
No, yeah, that the
So
videos and
because
presentations
now
are
the
different,
thing
but
is
Is
that's
that
there any literature to support that?
Yeah.
Is there any
No,
literature?
I
You're saying videos are there.
I didn't find.
We don't really validate.
But you, if you go to any conference, any talks, this is the take-home point is always given that there is should be an iris abscission.
yeah,
Or
ab-
whatever.
absolutely correct. You are saying that iris products should be removed, but that's the duration. That the time of presentation, mode of injury, and the nature of injury is important in selecting the iris tissue excision. It's the tissue which is needed. God has given, not to excise and throw it out. XYZ has done it. That
Exactly the
doesn't mean
point.
that we are
Exactly the point I want to buttress.
okay. Fine.
Sir, any other precaution in terms of antibiotic use or anything, any extra?
No, nothing extra. It's the same as same process.
Okay. Thank you.